Okay, so yeah, video conferencing and like the impact of how COVID has transferred everyone to use video conferencing. So obviously COVID has forced a lot of companies in this industry to like shut down and stuff like that. And and some companies thrived and went virtual, and they were able to do that through video conferencing. So the video conferencing is actually was very made a huge impact for the world for everything to move forward accordingly. Conferencing is basically like just software, so multiple parties can connect with each other through video and audio, through internet, and has features such as file sharing, screen sharing, and just cool little abilities such as the virtual background, so that companies can integrate that and have a better experience for their employees. So we can move on to the next slide, Jack. So the top companies that we have under the video conferencing is Zoom, WebEx, Google Meet, and Microsoft Teams. And these companies were able to thrive while other companies were declining. And that's due because companies were just leaning on these companies to move forward with their business conduct. So they racked up hundreds of millions of views on their platforms and stuff like that. So first company I'm going to be talking about is Zoom. Zoom is one of the top companies in the video conferencing industry. It was founded by Eric Yuan in 2011, and before COVID, they had 10 million users in the month of December, and they accumulated $122 million for the whole year of 2019. But as we can see, after COVID, they've increased their 10 million users to 300 million, starting in April, and it's been around 300 currently. And they've accumulated 328 million just from February to April. So they more than doubled the 10 million, the 122 million in just 3 months. And they're on track to do $900 million for the whole year of 2020. So next company I'm going to be talking about is WebEx. So WebEx was founded by Subrat Liar in 1995. And actually, the founder of Zoom is the vice president of engineering for WebEx. He wanted to change things because he saw things were kind of declining and customers weren't happy with the product, and the company weren't listening to him. So he decided to leave and create Zoom. So he got successful with that. So WebEx, they also had 10 million users in 2019 before COVID, and then after COVID, they increased also to 300 million users currently. And their revenue wasn't really disclosed. It wasn't really showing what exactly they made before and after COVID with the revenues, but obviously, it's definitely increased, stuff like that. So the next thing we're going to be talking about is Google Meet. Google Meet is the less popular, but it's still one of the top companies. So Google launched this product in 2017. They had 4 million users in the beginning of January of this year, and then they had 1.54 billion in revenue at the end of the quarter one of 2019, and that's including Google Meet and then some of their other cloud-based products. So after COVID, they increased their users to 100 million users, and then their revenue went up 55% at the end of Q1 to $2.8 billion in revenue. So the last one we're talking about is Microsoft Teams. So Microsoft released this product in 2016. They had 20 million users by the end of 2019, and then increased their users to 75 million. And also their revenue was not disclosed as well. Did not show specifically what the revenues were before and after. So now we're just going to get into the benefits and just the cons of video conferencing. So the first benefit we have is increased engagement. And that is in comparison to just audio, because back in the day, the standard would have just been an audio conference call. But now that we have video, it's more engaging, it's more interactive. Members are able to pay more attention because they have something to look at, and it's just more enjoyable for the employees to be able to see their employees' faces, bosses' faces, and just see the facial expression. So the next one we have is cost effectiveness. And that is, when we look at how much money is spent due to travel, booking hotels, food, companies save a lot. Company individuals save a lot of money just by using this video conferencing software. So it is a big cost effective strategy. So next one we have is collaborative flexibility. And, anywhere in the world, teams can come together and work together. It doesn't matter where you are. So that's a big plus. So the next thing we have is feature innovation. And I say it's because, with a majority of people on using video conferencing now, this is definitely like a catalyst for other companies to conduct business virtually and to have new businesses conduct their businesses in a way that's more fun for digital users and stuff like that. So we'll get more digital companies doing, we'll have other companies transforming to virtual online use. So, for that. And also, Jack, you could go over to the statistics slide that I have. We have a bunch of statistics here that is just showing how employees, CEOs, and just bosses prefer the video conferences. For example, we have the 66% of business executives say video conferencing helps them to better connect with freelance or gig workers. Then we have the 55% business say video conferencing effectively increase employee engagement. So there's a bunch of data here that shows that we are more pushing towards just being virtual completely. And then for the last benefit that I have is just we just get happy employees when employees are able to just work at home and be at the comfort of their family. They're generally going to be happy with working because they're in the environment that they want to be in. So that's also a benefit. So the last things I'll talk about is just the cons of video conferencing. So obviously we have the tech issues. So obviously like if the Wi-Fi is out, you're not connected to nothing. So that's an issue, malfunctions and, just poor video and audio quality it will always be an issue too. So, obviously in person, that's not an issue. So the next thing we have is data breaches and hacking. And, obviously when we're using software like this with so many users on it, it's definitely succumbed to hackers infiltrating data, like, because, you can file share, you can screen share. Hackers can hear, sensitive conversations. This actually happened to Zoom. Their data actually got leaked because their software wasn't yet prepared for the influx of amount of customers that they were having. So they actually had some of their data leaked and hackers were able to have access to that. But they have now fixed that with end-to-end encryption. So their stuff is encrypted now, so it's much harder for hackers to really hack into it, but that is definitely a con. The next con we have is time zones. Obviously, if you work internationally, you're gonna have to take into account when to have these meetings because you have to make sure everyone's able to attend. So you just have to be ready to have meetings either late at night or really early in the morning. So it's definitely a con because just the inconvenience of it all, and there's definitely another con. And then just the last con that I have is just the personal contact. And obviously, like, this is what we want because of COVID. But there's some big takeaways such as like, you're able to read the room and see if you're going in the right direction for decision. You're able to read body language, and just that human interaction is just overly going to be better than just the video all the time and stuff like that. And then another con that's not even up there is just having the video conferencing is just a strain on your health, like eyes wise, and just sitting down for a long period of time. So that's also a con that it can have like on your health, stuff like that. So now Jack's going to take over and talk about the many sectors that's involved with video conferencing and COVID.
All right, thanks a lot, Robbie. Appreciate it. I'm going to spend some time discussing a few sectors that have been impacted by COVID-19 social distancing and stay-at-home orders, but have been able to sustain and utilize a form of this technology and that we've been discussing. That is education. There are several benefits for virtual learning, specifically on the adolescent and adult side of learning environments. For younger children, we found there's more cons than pros in regard to virtual learning. Utilizing video conferencing software for virtual learning allows younger children to benefit from learning at their own pace and allows them to become more familiar with using technology for educational purposes. Parents can also use this time as an opportunity to empower their children by encouraging them to set a timer for class, recess, lunch, and so on. This will allow the children to gain a sense of autonomy and responsibility during these times. Adolescents and adults have more benefit from the virtual learning environment. They can benefit from the flexibility of managing virtual studies, as well as employment and family. Saving time traveling to and from the education site also allows for time to manage additional and other responsibilities that one may have. Virtual learning on such a large scale can be complicated. Families and individuals are dealing with many challenges, and you see this from the grade school level through the college level. Some of the challenges include families are struggling with technology. As a matter of fact, teachers may also be encountering a level of challenges and frustrations with the technology. Next, some families do not have the resources and/or access to the devices, the internet speed, the time, and availability, as well as support to provide the ideal learning environment. I know of families who have even reported feeling completely lost with their children's schoolwork. Some families do not have the option of staying home with their children to take advantage of virtual learning, while many families depend on school hours for their children so that they are able to work. There are also concerns regarding the development of age-appropriate socialization skills. For children, school isn't only a place for academic learning, but also allows for the development of age-appropriate social skills. In regard to special education, many families who are raising children with special needs report concerns with the quality of teaching on a virtual platform. Child study team staff have also reported challenges maintaining individualized educational plan during these unprecedented times. Now we're going to take a look at healthcare from the provider perspective, as well as the patient/client perspective, its relationship to video conferencing software. There are many factors to consider when utilizing video conferencing software for telemedicine. It is not as simple as downloading the software or purchasing the software and getting started. When dealing with protected health information, better known as PHI, the law is clear. Medical providers are required to comply with the Health Insurance Portability and Accountability Act of 1996. This is better known as HIPAA, or deal with potential exposure to litigation. At the start of COVID-19's global pandemic, many healthcare providers began scrambling to figure out the telemedicine process. Although some were already utilizing telehealth, many were not. This is truly evident by the growth statistics that Riley discussed earlier. To appropriately use video conferencing software in healthcare, the software must be compliant with the laws that govern our healthcare system. The Health Insurance Portability Act of the Portability and Accountability Act of 1996 is a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. We all received an email on July 15th as the records community. The email was from Michelle Lauren. She's the Senior Vice President and Chief Information Officer, and William Lansbury. He's the Associate Vice President, the Office of Information Technology. In the email, they were letting us know that Zoom is now available to us as part of the Rutgers community. Additionally, the email discussed the HIPAA compliance. The email states, for those who handle protected health information, PHI, Zoom for Rutgers is compliant with the Health Insurance Portability and Accountability Act of 1996. If you handle PHI, you will be assigned an account that is appropriate for your use with restricted data. If your role at Rutgers is not flagged for interaction with PHI, you will see a message upon signing up for Zoom indicating that your account is not for use with restricted data controlled by HIPAA. The email makes it clear that Rutgers has a BAA with Zoom. A major factor many healthcare providers have to consider when choosing the best video conferencing software for their practice is the Business Associate Agreement, again known as the BAA. The BAA is a signed document that affirms a third-party service provider's willingness to accept responsibility for the safety of your client's PHI, maintain appropriate safeguards, and comply with HIPAA requirements when they handle PHI on your behalf. Here are some examples of third-party service providers that should provide you with the BAA if they handle your client's PHI. One would be a billing service. A lot of medical providers utilize a third-party medical billing agency to do all of their medical billing. Now, when medical providers utilize these agencies, they should get into an agreement with that third party, can basically come detailing how they're going to keep the PHI protected. On the provider side, a part of the HIPAA compliance form that the patient would sign, they would also have a stipulation in there stating that their medical information would be shared with third parties, such as for medical billing and so on. Another example would be an EHR software provider, which would be electronic health records. Electronic health records is where, the provider may input progress notes, may input diagnoses, and so on. And again, they would be required to get into a BAA agreement. So although there are plenty of platforms available, such as Zoom, DocSeeMe is another one, which allows for telemedicine, utilizing the platforms that we've been discussing. You find that not all of them offer the BAA. Zoom offers the BAA through their paid membership. Their free membership doesn't offer a BAA as an option. COVID-19 has undeniably impacted the healthcare system in the United States. Federal and state officials have taken measures in the form of legislative action, executive order, and emergency declaration to respond to the rapid change in societal norms and the overwhelming need for physical, emotional, and mental health services. They have been both negative and positive outcomes of these actions. The global pandemic has forced lawmakers to alter the way therapeutic services and medical services are being delivered. On March 21st, 2020, Governor Murphy of New Jersey issued an executive order which directed all New Jersey residents to stay at home until further notice. As a result, clients receiving face-to-face services were limited in their ability to continue receiving therapeutic and medical services to maintain mental and emotional well-being. In response to the overwhelming need for mental health services to continue despite the global pandemic, New Jersey 830 was introduced on March 16, 2020. This law allowed for healthcare providers servicing Medicare and Medicaid patients and their clients to receive medical and mental health services via telehealth. The law proved invaluable very quickly. Under this new legislation, mental health care and other forms of medical care would be accessible to Medicare and Medicaid clients despite location. And New Jersey waived site requirements and allowed medical providers to provide services via telehealth from any location, and clients were able to also receive services from any location. Additionally, NJ 83860 allowed unrestricted use of alternative technologies to provide telehealth services. Lastly, the federal government relaxed HIPAA restrictions on the use of technological devices, which meant there would be no penalty for providing services non-compliant with previous HIPAA laws, as long as the services were provided in good faith. Now that's a little vague, the way that this was written, like the way that the federal government disclosed or gave us feedback as to relaxing the laws regarding HIPAA compliance, and as long as the services were done in good faith. This in itself does not relinquish a medical provider from exposure to any form of litigation. There is still a potential for litigation, and even though that's what that's the information that we received from the federal government. Access to telehealth offered clients without transportation, those tested positive for COVID-19, physical disabilities, geriatric patients, and certain mental health disorders such as agoraphobia and social anxiety disorders, the ability to attend scheduled sessions consistently. Med monitoring is also a big thing for patient and clients, so that they're properly medicated. And with the social distancing caused by COVID-19, many people are having challenges with getting to their healthcare provider for appointments so that they can continue with their med monitoring. This allowed for patients and clients to be able to meet with their medical provider via telehealth so that they can be properly medicated. I'm gonna try to hurry up. Business. That again, with business, it allows for the onboarding process. It allows for more personal meetings, saving time and money, providing users with convenience, recording tools. It also provides recording tools. This technology is widely used from news media interviews. If you think about all the talking heads, if you watch any 24-hour news channels, you'll see WebEx on, like WebEx at the bottom of the screen. You'll see Zoom. You see a lot of people working from home, utilizing their home offices or even in their kitchen. Bob Costas is constantly on CNN, giving news updates specifically from the sports perspective. You have sports media, interviews, board meetings, so on and so forth. In the PAMBA program, we had a lunch and learn with Deloitte last week, and when we discussed travel post COVID-19, some mentioned things may drastically change. There's a strong possibility the previous norms regarding travel may be one of distant memory. All right, guys. Thank you.